Hello, I'm Dr. Beech. You know, patients come in a lot of times to see us for neck pain and headaches and pain in their shoulders. And this is a part of our modern society because we're sitting at desks all day and we're working and our head is down. I want to explain a little bit about the biomechanics of neck pain. What happens is our neck, which is relatively small compared to the rest of the body, has to hold up our head. And our head weighs about as much as a bowling ball, 8, 10, maybe 12 pounds in some cases, but it's a, say, 10-pound weight. Now, if you take a 10-pound bowling ball and you hold it here at your chest, that's 10 pounds. But then extend your arms out, and now the weight has increased exponentially because the weight is relative to the length of the lever. So ladies know that if you pick a purse up, it weighs one thing here, but if you pick it up this way, it weighs a lot more. Same way with the neck and the head. So the position of the head should be over the shoulders. But because of several factors, many times we develop something called forward head tilt, where instead of the head being right over the shoulders and over the spine, we're now carrying the head out here in front. And that's like holding the bowling ball forward and letting the weight of that extra weight, because of the length of the lever has been increased, that weight has to be counterbalanced by the muscles in the back of the neck and in the shoulders. So let me give you some examples. Sitting at a desk and looking down for a long period of time like this, we're working at the desk, then that causes these muscles to contract 300-400% more than they normally would contract. Now, if you put your hands together and pull, you'll notice that you feel the pull where your fingers are interlocked. That's because when you pull on a lever, the stress of the lever is at the attachment point. So the attachment points for these muscles are right along the base of the skull and up here in the shoulder area. That's why people get headaches, because of this tightness in the back of the neck, and then they get these nice knots in the shoulder, and people come and squeeze each other's shoulders and that kind of thing, because these knots build up in the trapezius muscle and then the levator scapulae muscles that are counterbalancing, because that's where this is the origin of the muscle, the insertion of the muscle, so that's where they connect. And that counterbalance effect that they have to do, which is increasing the contraction to hold the head forward so your head doesn't just fall down, is creating that tightness in the neck. So those muscles can get really sore and really tight. So sitting at the desk improperly can be one reason, having the head forward. And then another reason can be posture. We did a video on posture and talking about how the feet, if the feet pronate, then the pronation of the feet makes the body's center of gravity go forward. And then to counteract that, we have to arch our back and bring our head forward. And that position is because of the imbalance in the feet. Then if we happen to be doing a job where we have to look down all the time, we're reading or we're writing or something, maybe we're working at a table or something and having to stay down, that we are a product of our environment. And so that can also create that problem. Now, chiropractic can help this, because when we do chiropractic adjustments of the neck, it relieves that tension. It allows the blood flow to come back into the area. And then we have other therapies that will relieve the tightness in the muscles. I use my Ayurvedic transdermal creams many times to help with that, to open up the channels and get the toxins out of the muscles to help. So there are many things we can do, but we also have to always look at those, as I like to stress, the etiological factors like posture or positioning with our workspace and that type of thing, because otherwise we're trying to fill a bucket with a hole in it. It just keeps coming back over and over again. So I'm going to do some other videos on other aspects of this. I want to do one video on ergonomics and explain how to sit properly so that our head isn't in this position. And also we're going to do a video just on whiplash injury and talk about how that can affect the neck as well. But this sitting posture and forward head tilt is, in my opinion, one of the most common reasons for chronic neck pain that's just been there for a long time and doesn't seem to go away.